Thank you for joining us to learn about the Masters of Science in Nursing Entry to Nursing Practice program offered by the Edson College of Nursing and Health Innovation at Arizona State University. This presentation is intended for prospective nursing students who have a regionally accredited bachelor's degree in any discipline other than nursing and wish to become a registered nurse. First, we'll start with an overview of the program. This nursing pathway is a clinical nursing program for students who have a bachelor's degree in a discipline other than nursing from a regionally accredited college or university. Applicants with a bachelor's degree in a discipline other than nursing earned at an institution outside of the United States are also eligible for consideration if admission services recognizes their degree and institution. Students who are admitted to and successfully complete all requirements of this nursing pathway will earn a Master's of Science in Nursing and be eligible to sit for the NCLEX RN. Please note that a Bachelor's of Science in Nursing, or a BSN, is not awarded through this pathway. This program starts annually in the fall semester and is approximately 5 semesters in length. The program is taught year-round without summer breaks and 20 months long. This slide shows a sample plan of study for the MS Nursing program. Again, it's designed as a year-round 5-semester clinical program. The program includes didactic coursework, experiential learning, and clinical experiences. Concepts covered include the fundamentals of nursing, pharmacology, healthcare systems, complex care, and more. Experiential learning will take place in our simulation centers. In simulation, nursing students will practice hands-on skills in a variety of simulated healthcare settings with high-fidelity mannequins and healthcare equipment. Furthermore, nursing students will participate in clinical experiences, including long-term care, women's health, adult health, psychiatric and mental health, and pediatrics at our partner healthcare agencies in the greater Phoenix metro area. All components of the nursing program are preparing students to successfully pass the NCLEX RN. Please note that the plan of study is subject to change. Students in this program will need to be flexible and adaptable to ensure they can meet scheduling requirements. Courses and clinicals may occur at any time, including evenings, overnights, and weekends. Clinical placements occur all over the Metro Phoenix area. It is required that students have reliable transportation or access to ride-sharing services. Students will not be able to select their clinical placement locations. We're often asked if students can work while enrolled in this program. We recommend that students do not work in their first semester. After completion of the first semester, students can decide if they have time to accommodate work in their schedule. Now let's discuss the prerequisite requirements and course evaluations. These are the 8 prerequisite courses all students must complete before they advance into the clinical nursing program. You may also hear these referred to as critical courses. You will notice these courses include healthcare-specific classes such as human nutrition and human pathophysiology, as well as lab sciences, such as human anatomy and physiology, chemistry, and microbiology. You will also need human development and statistics. All prerequisites are available to take at ASU, either in person or online. They can also be taken at another regionally accredited institution. Prerequisites completed at another institution must be evaluated for equivalency to the prerequisites using ASU's transfer guide. The transfer guide can be found online at asu.edu/transfercredit. If your course is not directly equivalent to one of our prerequisites, you will need to work with an Edson College Student Services team member to review your options. If you wish to take a prerequisite course outside of ASU, but are having difficulty locating a direct equivalent in the transfer guide, these prerequisites are available through Rio Salado, an online community college which is part of the Maricopa County Community College District. A higher level chemistry course may fulfill the chemistry prerequisite, but should be verified with an Edson College representative prior to applying. We're often asked what courses meet the statistics requirement. Any undergraduate course with statistics in the course title that also has the Computer Statistics or CS designation in ASU Class Search or the Transfer Guide can be accepted. If a course does not have both statistics in the course title and a CS designation, it may not be accepted. A few important notes on prerequisite courses. Applicants may be admitted to the program with deficiencies or courses in progress. A deficiency is essentially a prerequisite that is not complete at the time of application. For applicants admitted with deficiencies, all required coursework must be complete with a grade of B or higher, posted on official transcripts received by ASU by the date specified by the admissions committee. This is typically around June 1st. Priority consideration may be given to applicants who have all or most prerequisites completed at the time of application. At the time of application, a prerequisite GPA will be calculated based on completed prerequisite courses. A minimum 3.0 prerequisite GPA is required for eligibility. There are some limitations on prerequisite courses that are important to know. First, the required science courses, including Bio 201, Bio 202, Chem 101, Microbiology 205 and 206, and HCR 240, must be completed within 10 years of the semester in which the clinical nursing program will begin. If a course is older than 10 years, it's expired. Please speak with an Edson College Student Services team member to talk about your options. Second, all undergraduate coursework completed outside of ASU must be officially evaluated by ASU through the Transfer Guide. Students can submit courses for evaluation online at asu.edu/transfercredit. On this website, click the course search link. You may find that your transfer course is already evaluated in the Transfer Guide. If not, you must submit the course for evaluation. We will review this process in the next few slides. Lastly, course repeats are not permitted if you earned a grade of C or better in any prerequisite course. If you took a prerequisite and received a D, E, or W grade, you may repeat the course to earn a C or higher. For options to improve your prerequisite GPA, consult with an Edson College Student Services team member. Now let's talk a bit more about prerequisites completed outside of ASU. Only courses completed at regionally accredited institutions may be considered. Courses taken at extension campuses are not accepted. Applicants must ensure courses completed outside of ASU are directly equivalent to the prerequisite courses. To determine equivalency for undergraduate level courses taken outside of ASU, applicants should use ASU's Transfer Guide to look up each course they wish to use to fulfill a prerequisite. In the Transfer Guide, if a course is directly equivalent, the course will meet the requirement. In the example here, a student took FON 241 for 3 credit hours at another institution. This course, if taken in the effective date range listed here, is equivalent to NTR 241, which is our nutrition prerequisite. If a transferable course is not a direct equivalent in the Transfer Guide, it may list another course entirely, or it may show as an elective. In any of those scenarios, it would not be considered a direct equivalent. We will talk about these courses in a few slides. If a course shows as non-transferable in the Transfer Guide, as depicted here, it cannot be used to fulfill a prerequisite. If a course is equivalent to an elective in the Transfer Guide, but not directly equivalent to a specific prerequisite course, applicants should resubmit the course for review in the Transfer Guide by clicking Submit Courses for Evaluation. Include a course description or a syllabus for the evaluation. When submitting, applicants should indicate in the notes which prerequisite they would like their course reviewed for. If the evaluation results indicate the course is not equivalent to the desired prerequisite, contact Edson College to discuss review options. If a course is not listed in the transfer guide, this means it has not yet been reviewed and must be submitted to the transfer guide for evaluation. Now let's shift gears to graduate course equivalency. If you have taken a graduate level course, either at ASU or another regionally accredited institution that you would like to use to satisfy one of our prerequisites, please contact Edson College directly for further instructions to have your course evaluated. The transfer guide cannot be used to determine equivalency for graduate level courses. The transfer guide is only used to evaluate undergraduate transfer coursework. Next, we will review steps to apply for the MS Nursing Entry to Nursing Practice program. To apply for the program, all applicants must submit the following materials: a graduate admission application and application fee, official transcripts, 2 letters of recommendation, a letter of intent or goal statement. The prompt for this can be accessed on the application only, a professional resume, prerequisite course information. Please note that an interview may also be required. International applicants will also need to submit proof of English proficiency if required by admission services. And please note that materials are subject to change each admission cycle. Applications will only be reviewed once completed. As mentioned, this cohort starts once per year in the fall, which starts in August at ASU. The graduate application opens September 1st the year prior. For example, the application for the fall 2022 cohort will open September 1st, 2021. The priority deadline to complete the application may vary each cycle, but will be posted on the admission application. For the fall 2022 admission cohort, the application deadline is February 1st, 2022. We recommend applying early to ensure you complete your application by the provided priority deadline. An application is considered complete when all materials are received by ASU and posted to your account. That includes transcripts, letters of recommendation, prerequisite information, and all additional materials required for the application. Students who are admitted will attend for 20 months or 5 semesters. We expect to have 48 seats available in each cohort. This is subject to change and based on clinical availability. Let's review additional important information about the application and selection process. All applications completed by the priority deadline will be reviewed. To be considered complete, all application materials must be received by ASU. Applications completed after the deadline will be reviewed on a space available basis. We do not have a timeline for this review. Applicants who complete their applications after the priority deadline will be reviewed as spaces become available. For example, an admitted student might decline their seat the summer before the program begins. Selection will be based on a review of all application materials. Applicants will not be ranked by their GPA, although GPA will be considered in the admission process. The selection process for this program does not include entrance exams such as the GRE or TEAS. Applicants should check their email regularly for updates in case the admission committee needs additional information to review their application. Beyond the application materials, students selected for admission will need to meet additional requirements to enroll in the program. All clinical nursing students must meet health and safety requirements. These items will be verified through a third-party system called Castle Branch. Once admitted, students will be prompted to submit this information directly to Castle Branch. This chart shows the titers and immunizations required as of the recording of this presentation. In addition, all students must have their CPR and basic life support certification through American Heart Association, their Arizona Level 1 fingerprint clearance card, and a TB blood test. These requirements are subject to change based upon the requirements of our clinical partners. When you apply for admission to the program, you will be provided with an application guide with additional information. You can also review the nursing information packet now for more details. The link to that packet will be provided at the end of this presentation. In addition, all students selected for admission must meet the following requirements. Students must have health insurance coverage. They must submit a statement of health clearance. They must submit to a drug and alcohol screening, and a criminal background check will be completed. Again, health and safety requirements are subject to change. Tuition and financial aid information can be found at these websites. Let's review next steps. Prospective students who plan to apply for the MS Nursing Entry to Nursing Practice program should continue to complete any necessary prerequisites. If you have completed undergraduate level courses at another institution, or if you have taken any graduate level courses that you wish to use to fulfill the prerequisite requirements, follow the process as outlined in this presentation to ensure their applicability to our prerequisites. Apply for admission beginning September 1st using the graduate admission application for your desired cohort. Again, the application opens September 1st, approximately 1 year before the program begins. The priority deadline will be provided on the application. We also highly recommend that students interested in the MS Nursing program explore other ASU nursing pathways, including the Accelerated BSN. The Accelerated BSN is a 1-year clinical program for students who have a bachelor's degree in another area. The Accelerated program is offered at ASU's downtown Phoenix campus starting each spring, and the ASU at Lake Havasu location starting each fall. The requirements for the MS Nursing and the Accelerated BSN vary. If you are interested in the Accelerated program, please watch the information session and review the nursing information packet for more details. This slide contains helpful links to use as you navigate applying to ASU and the MS Nursing program. Please take note of these resources. If you have any questions, we're here to help. Prospective ASU students who are not yet admitted to ASU should contact our recruitment team. Current ASU students should contact our advising team to learn more. Thank you so much for your time today. We hope this presentation and all of the other resources shared are helpful as you explore the MS Nursing Entry to Nursing Practice program at ASU.